You can start, Prabhu.
Okay, sir. So, good evening, senior vascular surgeons of India and my colleagues. I would like to thank VSI and Tapisha for initiating this study program, which is very helpful for us and for the budding vascular surgeons who are doing residency. And today, I'm going to present on less commonly considered atherosclerotic risk factors. Um, the slides are uploaded. Yeah. So I'm going to divide this topic into four things. First is the less common causes. The first one is hyperlipidemia, in that lipoprotein A, and second is the dietary factors causing atherosclerosis. In that, we are going to discuss about trimethylamine N oxide, and third is infectious causes, including various viruses and bacteria, and last, environmental toxins, which includes the persistent organic pollutants, heavy metals, and also finally the air pollution, which are all have been attributed to as a causative factor for atherosclerosis. First, these are the four way I'm going to discuss this particular topic. First, lipoprotein A. So the lipoprotein A is basically nothing but LDL plus apolipoprotein A. Basically, LDL itself has an ApoB lipoprotein. In this lipoprotein A, additional, it's a hybrid lipoprotein where another apolipoprotein A is being added to the LDL. And as we can see in this slide, this lipoprotein A has both pro-atherogenic as well as pro-thrombotic activities. And how it become pro-atherogenic is it increases the oxidized form of the phospholipids, and it increases the foam cell formation. Also, it is attributed to SMC proliferation also. And also, the particular apoprotein A, the structure of apoprotein A is similar to the plasminogen. Thereby, it reduces the plasminogen activation and thereby increasing the thrombosis. And how the mechanism of action, as I have already explained about it, we can see the second paragraph. The ApoA component is similar to the plasminogen in terms of the structure, and hence it competes with the plasminogen for the binding sites, resulting in reduced fibrinolysis and formation of blood clots. And various treatment regimes has been used for this raised lipoprotein level, including the statins and niacin, which are the first-line drugs for increased LDL as well as LPA. And recently, the PCSK9 inhibitors, which are proprotein convertase subtilin K9 inhibitors, which are being used recently being approved for the treatment of raised LDL and LPA. And in refractory cases where the LDL levels are very high or the LPA levels are very high, apheresis have also been tried in various countries. And this slide, I would like to mention 2 points. When is LPA apheresis is indicated? So one, in homozygous familial hypercholesterolemia, and second, in heterozygous form of familial hypercholesterolemia, where the LDL-C levels are more than 200 with CVD or more than 300 without CVD. We can see the highlighted last line. Various countries follows various indications, but these are the two most common indications where it is being used. So going on to the next, what are the dietary factors which can lead to atherosclerosis? So this trimethylamine, which has been studied for a longer period of time, these trimethylamine are derived from carnitine and phosphatidylcholine, which are rich in red meat, dairy products, as well as in the eggs. So these TMA, once it's absorbed, it is once in the GI tract, it is converted by the intestinal bacteria into trimethylamine N oxide. So this is the carnitine and the phosphatidylcholine are converted into TMA by the intestinal bacteria, and this TMA, once it enters the liver, it is converted into trimethylamine N oxide by FMO3 enzymes. So we can see the effects of this TMA, how they cause the atherogenic environment within the vessel. First is it alters the cholesterol transport as well as it increases the platelet hyperactivity. So by these two mechanisms, it increases the atherogenic environment within the vessel, leading to enhanced thrombosis as well as atherosclerosis. Various studies have been done finding the effects of this TMAO, and multiple studies have shown that it's increased MACE in patients with coronary artery disease patients and also patients who are already had a heart failure or renal failure. These are the group of patients who are highly prone to increased cardiac events when due to the TMAO. And also multiple studies has shown the association between TMAO with PAD as well as MI and CAD. The more the possible choline consumption, increased cardiovascular specific mortality has been shown. And this is one of the study which shows that with the presence of TMAO, the cardiovascular mortality is increased in peripheral arterial disease patients. And going on to the next about the infection. So there is always a myth that infections also could be a causative factor for atherosclerosis, and various multiple studies have also shown the association between the infections and atherosclerosis. The most common organisms which have been studied and which showed association with atherosclerosis are viruses, herpes simplex virus 1 and 2, cytomegalovirus, hepatitis C virus, Epstein-Barr virus, and multiple enteroviruses. And when it comes to bacteria, chlamydia pneumoniae and Helicobacter pylori has shown association with coronary artery disease as well as peripheral artery disease. And the oral pathogens, so causing periodontitis, the Porphyromonas gingivalis, they are also been found to be associated with raised atherosclerotic risk. And the mechanism is basically all these studies doesn't show a direct association with a single bacteria or a single virus with the raised risk of atherosclerosis. Rather, it is the pathogen burden that has been associated with atherosclerosis. So thereby the mechanism that is proposed is pathogen burden hypothesis, where any infection, whether a viral or a bacterial infection, as we have discussed previously, the various organisms, they are going to activate the innate immune system, and which causes upregulation of the adhesion molecules in the vascular endothelium, VCAM and all. And also the TLR, the toll-like receptors of the inflammatory signs cells, which binds to these pathogen-associated molecular patterns, have also been upregulated. These upregulated innate immune cells not only binds to these organisms, also they binds to the oxidized LDL, thereby resulting in more foam cell formation and thereby increased atherosclerotic risk. So basically, when this slide shows that no big RCTs or large prospective cohort trials proves any association of this infection with atherosclerosis. But there are multiple case control studies which showed association with the coronary artery disease, ischemic stroke, and also MI for various virulent strains of H. pylori, chlamydia pneumoniae. In fact, in a study where they gave a long-term antibiotic azithromycin and galactofloxacin for over 1 to 2 years for patients, and they found out that more duration of antibiotics reduces the atherosclerotic risk, but it doesn't clearly association between a particular organism with atherosclerosis. And recently, this oral pathogens which cause periodontitis, these increases the inflammatory reaction in the intravascular inflammation and have been proved to raise the atherosclerotic risk. And this particular picture shows the various mechanisms, as we have already discussed, how the various organisms, the viruses, bacteria, increases the atherogenicity within the blood. Like platelet aggregation is seen in chlamydia and hepatitis C virus, and foam cell formation also being raised in chlamydia pneumoniae and periodontal pathogens. And LDL oxidation has also been increased by these organisms. And going on to the third, the environmental toxins. So environmental toxins, including one, persistent organic pollutants. These stay in the environment for a longer period of time. And the examples of these persistent organic pollutants are the herbicides, the dioxins, and the polychlorinated biphenyls. And one specific incident in the history is that the Agent Orange herbicide, which is being used in the Vietnam War, and various studies have been made on those soldiers who participated in that war, have found to develop diabetes mellitus over the next few decades, and increased atherosclerosis have been noted in these soldiers who have participated in this Vietnam War, thereby proving an association between these persistent organic pollutants with diabetes mellitus and raised coronary artery disease risk and MACE. And second is we will discuss in this environmental toxins are heavy metals, which are arsenic, cadmium, mercury, and in fact lead are also been known to be associated with increased risk of MI and CAD. And finally, the air pollution, where the air particulates, the free radicals, and reactive aldehydes have also been shown to be associated with increased atherosclerotic risk. First, the persistent organic pollutants. The sources of these persistent organic pollutants comes from the metal productions, the pulp and the paper mills, industrial waste, incineration, and as we told in the usage of herbicides in various bars have also been associated. And the thing is, the dioxins, when we have to discuss about the dioxins, these dioxins are more lipophilic. So they get adhered to the adipose tissue in the body and they alters the adipose tissue functions, leading to obesity, lipotoxicity, and intravascular inflammation is also raised, and thereby it is associated with diabetes, hypertension, and CVDs. And other mechanisms they have found out how these persistent organic pollutants are associated is through the aryl hydrocarbon receptors. These are the receptors which are present in every cell, which affects the cell cycle and also promotes the inflammation. And they also, another one thing is they also upregulates the FMO3. These are the enzymes which converts, as we have seen previously, converts the TMA, the trimethylamine, into TMA-N oxide, thereby having a causative association with dietary factors also. And these environmental toxins have also been known to upregulate inflammatory mediators by altering the intracellular calcium levels. Going on to the heavy metals, three metals have been mentioned in Rutherford, which are associated with raised atherosclerotic risk, including MI and all. The first is the arsenic. So the arsenic, the sources of arsenic are burning of coal. In fact, for all the most of the heavy metals, the sources are burning of coal, waste incineration, smelting, where they produce these metals from the metal ores, and also the paper production have been associated with raised arsenic levels in the water as well as in the air. So we can see this particular picture where I have shown Ganga, Meghna, Brahmaputra plain, where this is the plain in India where the arsenic toxicity is highest in water level. And the main mode how this arsenic enters into our body is through the drinking contaminated water with arsenic. International standards mention that even less than 10 microgram per liter is toxic to the body. But Indian waters contains, studies have shown that Indian waters contains minimum of 50 micrograms of per liter of arsenic in the drinking waters, especially in this Ganga, Meghna, Brahmaputra plain. So these raised arsenic level have been associated with diabetes as well as hypertension, and also CAD, stroke, and PAD have also been associated with exposure of arsenic. Most commonly due to the mechanism is being the acting like a free radical and mitochondrial dysfunction. Going on to the second heavy metal, cadmium. So these cadmiums are released from contaminated vegetables, especially the greens and the potato, which we all eat every day, and also the smoke in the air smokes, as we have seen in the previous like the paper mills and other things, and water contamination by cadmium. And the important thing is this cadmium is also seen in higher concentration in tobacco plants. So those who use tobacco more will also get higher exposure to the cadmium levels. So the 40 to 50% of inhaled cadmium as well as 3 to 7% of ingested cadmium from contaminated vegetables are absorbed in the GI tract, and they are into a complex with a metallothionein. And this particular complex accumulates in various organs for several years. Like half-life is up to 4 to 20 years. So how they and various studies have shown increased incidence of MI, stroke, and PAD with raised cadmium levels. How they causes is basically they increase the density of macrophages in the plaque and thereby leading to progression of the plaques in the intravascularly, and also effects including disruption of the endothelial integrity, increasing the free radical production, and also depletion of the free radical scavengers also have been mentioned in various studies uh, regarding the toxic effects of cadmium. And third, interesting, the third heavy metal is mercury. So as we know, the mercury is emitted to the atmosphere through various industries and all. And this mercury is deposited in rain and snow as gases and particles. And then they get accumulated in the lakes, reservoirs, and forests. And the fish which grow in those lakes um, are going to become bioaccumulated by these mercury, especially shark and tuna. So those who eat more fish, the more will be the exposure to the mercury level. And the mercury half-life is also very high of around 3 to 4 years. And various studies have shown, especially Finland study showed a strong association of mercury with MI, and also increased death from coronary artery disease have been noted in those patients with high mercury levels. And finally, air pollution. So air pollution, either in the form of particulates, as we know, the air pollution is due to the automobiles and also the industrial gas releases, and they can be in three forms, like particulates, free radicals, and also reactive aldehydes. In these three ways, they can affect our body. And we can see in this picture multiple ways. They most common is that inflammatory stimuli is very common with air pollution. Whenever we are exposed to more air pollution, more is the inflammatory stimuli, leading to raised cytokines, CRPs, and all, and MMP activation, which in turn leads to the platelet activation and resulting in plaque formation as well as plaque instability. And there is strong association between increased air pollution with development of type 2 diabetes, also raised CRP levels, and increased prevalence of coronary artery disease, ischemic heart disease, and congestive cardiac failure in those who have exposed for a longer period to air pollution. And the mechanism is basically, as we discussed, systemic inflammation, and also insulin resistance have also been noted in those exposed to extreme air pollution, like we people in Delhi, and innate immune system activation through the toll-like receptors, as we have studied in the infection, also have shown also the mechanism of how the air pollution deleterious to the intravascular milieu. And the mitochondrial dysfunction, this is a theory which has been um, proposed, which is due to the free radical stress because of this air pollutants, which causes increased, which in turn, once a mitochondrial dysfunction occurs, which in turn leads to increased oxidative stress and multiple mutations in the DNA, decreasing metabolism, thereby again increasing the atherosclerotic environment within the vessels. And so I think I've covered all the less commonly considered causes of atherosclerosis.